Hello everyone, and thank you for joining us. This is a summary of the key messages delivered by Dr. Rosa Contreras during the opening session of the PROA Club. Let's walk through the main ideas she shared with us. Brain Part 1: Understanding PROA and Why It Matters. Dr. Contreras began by introducing the concept of antimicrobial stewardship programs, PROA. She emphasized that these programs are not isolated initiatives. They represent a new way of working as a healthcare team, based on evidence, collaboration, and clinical responsibility. She reminded us that antimicrobial resistance is one of the greatest threats to global health. The COVID-19 pandemic accelerated the inappropriate use of antibiotics in many cases, which has only worsened this problem. She also made it clear that PROA is not only for infectious disease specialists or pharmacists. It's a shared responsibility that includes nurses, physicians, managers, and institutional leaders. Everyone who takes part in patient care has a role to play. Dr. Contreras explained that the PROA Club is here to help us take that first step, or deepen the path, toward implementing stewardship practices in our institutions. Pill special focus: antibiotics, discovery, resistance, and the crisis of innovation. One of the central topics covered by Dr. Contreras was the story of antibiotics, their discovery, their benefits, and the risks we face today. She recalled that the discovery of penicillin in 1928 marked a revolution in medicine. Infections that once killed millions became treatable. Antibiotics saved lives and transformed public health. But she also warned that we are at a turning point. Decades of overuse and misuse, both in hospitals and in agriculture, have led to growing antimicrobial resistance. Bacteria are evolving faster than our ability to produce new drugs, and that is deeply concerning. She also pointed out that very few new antibiotics are being developed today. Why? Because they are no longer profitable for pharmaceutical companies, and because clinical guidelines rightly limit their use. That means we are burning through a limited resource, and once it's gone, we may not have replacements. Every unnecessary dose of antibiotics is a dose we're stealing from the future, she said. This crisis is not something that will happen, it's happening now. That's why antimicrobial stewardship is no longer optional, it is an ethical and clinical imperative. In the second part of her talk, Dr. Contreras focused on practical guidance. She encouraged everyone to start where they are, with the resources and team available. You don't need a perfect team to begin. You just need motivated people who care. She outlined the key actors in any PROA team: medical leadership, pharmacy, microbiology, and, crucially, institutional support. She shared examples of simple first steps.